All right, welcome everyone. We will get started here in just a moment. Please hang in there for just a moment as we let folks in and get settled into the room. And we should start here probably about 2:02. All right, looks like our attendees list is stabilizing here, so we will get started. My name is Ariel Finney, and I'm the WA Cares Fund Policy and Rules Manager. I'm here today with Maria Mangaro, the WA Cares Fund Eligibility Program Manager, and welcome each of you to the 5th installment of our rulemaking meeting listening series, or listening session series that we are doing. We are part of the Department of Social and Health Services WA Cares Fund team, or Washington Cares Fund team, working on rulemaking for a new chapter of Washington Administrative Code. Each meeting, we are focusing on specific topics related to rulemaking, and today we will be focusing on assessments for beneficiary eligibility. We will only be addressing rulemaking for the Department of Social and Health Services in this meeting series. Employment Security Department is also doing rulemaking, so please reach out to Employment Security Department if you are interested in their rulemaking activities. For those of you who have joined us in past meetings, some of this will be consistent with what you've already seen, but if you are joining us for the first time, welcome. And we're going to go over a few items here before we get started, starting with our agenda. The agenda is up on the screen now, and we will start with a few housekeeping items, as well as go over some common terms, and then move on to a brief presentation by Maria on assessments. We'll use the information shared by Maria to set the foundation of our discussion today. And this session is scheduled for 2 hours, but we've been consistently running closer to 1 hour, give or take a little bit. So I expect we're going to wrap up a little bit early, but we do have time for discussion and to dig into our discussion points here at the end. Each meeting we have been following a pretty similar cadence here, where we go over the housekeeping common terms, we have a brief presentation, and then we move on to the discussion. And the discussion is really what we're here for, to be able to hear from you and get your input as we begin our rulemaking process. So we are very early on in our rulemaking process and just getting started. So today we're going to be focusing on getting information that's going to be helping us create our first draft of rules. So some housekeeping. The question and answer feature is available for questions throughout the presentation today. We will do our best to address questions as we go, but we may not be able to get to them all, or may know that we're going to be addressing them later on. So please be patient if your question is not answered live. We'll do our best to answer the questions during the webinar, but some questions may require a bit more research or follow-up than we'll have time for today. So we'll do our best to follow up with you outside of this meeting if we don't get to your question. The chat will be disabled during the presentation, but it will be made available as we begin our discussion prompts. And so you'll be able to use that to engage with the questions we have at the end. The recording of this webinar and the slide deck will be available on our website, listed here on the screen. I will also share that here at the end of our presentation. And our next meeting is scheduled for May 15th at 2 o'clock. We will be covering beneficiary rights and responsibilities and touching on the application process. So our purpose today is to hear ideas from you all about rulemaking. We are just beginning our initial drafts of rules and want to hear the values of our community so we can integrate that feedback and input into our drafts. Our focus today is on rulemaking and hearing your ideas and recommendations. In order to remain focused on the purpose of our meeting, we will not be addressing any program-related questions. If you have program questions, please email WACARES, WACARES @dshs health.wa.gov, and our customer care team members will assist in answering your questions. So again, this email address is going to be where you will send any program-related questions that won't be able to be addressed today during our presentation. I have some common terms up on the screen, and as we go today, we'll probably add to them. But I recognize that with government work, we tend to have our own language. And I like to cover these early on, so as we move forward in our presentation and our discussion today, you have some context for how some of these terms will be used and what they mean. If you've joined us in the past, these are hopefully becoming familiar for you. But again, if this is your first time, welcome, and let's review some common terms. Starting with the Department of Social and Health Services, we are the lead on the WA Cares Fund project. This meeting series is focused on the work being done by the Department of Social and Health Services, or DSHS. And you'll commonly hear us refer to the Department of Social and Health Services as DSHS, as I just did. Employment Security Department also has a major role in this project. Employment Security Department is leading the work on employee contributions. You will commonly hear the Employment Security Department referred to as ESD. Healthcare Authority is the third department responsible for a major part of the WA Cares Fund program. They're responsible for the payment system, verifying use of benefits, and establishing criteria for payment of benefits to providers. You will commonly hear the Healthcare Authority referred to as HCA. Long-term services and supports, or LTSS, refers to a variety of services and resources to assist people who experience a long-term disability to maintain their safety and comfort. The Revised Code of Washington, or RCW, refers to our statute or the language enacted by the legislature. These are the laws that provide program direction, limitations, and have granted us permission for rulemaking as the state agency involved in WA Cares. You've already heard me refer to WA Cares, or Washington Cares Fund, but you may also see us reference this as WCF. And Washington Administrative Code, or WAC, also referred to as WAC, are rules developed by government agencies to implement policies and procedures as delegated by the legislature. You may also hear WACs referred to as rules or regulations. When I refer to rulemaking, such as I've done already in this introduction here, given that this is a rulemaking listening session, it's regarding developing or amending Washington Administrative Code, or WAC. So our focus of this whole series, and particularly today, is going to be regarding creating WAC and making sure we have rules for the DSHS side of the Washington Cares Fund, or WA Cares Fund. So with that, I'm going to turn it over to Maria Mangaro to talk to us about assessment for beneficiaries.
Thank you so much, Ariel. Today we are going to discuss assessments, or the assessment, but I first want to review sections of the RCW. These sections should look familiar if you were able to attend the last rulemaking session. First, we have department duties. RCW 50B 040-04020 states that the Department of Social and Health Services shall make determinations regarding an individual's status as an eligible beneficiary under RCW 50B 04060. Next, we will review definitions in the statute. RCW 50B 04010 defines qualified individual as an individual who meets the duration of payment requirements as established in this chapter. It also defines eligible beneficiary as a qualified individual who is age 18 or older, residing in the state of Washington, has been determined to meet the minimum level of assistance with activities of daily living necessary to receive benefits through the trust program as established in this chapter, and has not exhausted the lifetime limit of benefit units. RCW 50B 04060 states that except for qualified individuals residing outside of Washington, as provided in A2 of this subsection, beginning July 1st, 2026, a qualified individual may become an eligible beneficiary by filing an application with the Department of Social and Health Services and undergoing an eligibility determination, which includes an evaluation that the individual requires assistance with at least 3 activities of daily living. I want to highlight the part that says, which includes an evaluation that the individual requires assistance with at least 3 activities of daily living. Okay, now we're going to dive into the assessment for the WAC Cares Fund program. We'll start by reviewing components of long-term care assessments and their purposes, such as instrumental activities of daily living, mood and behavior for individuals experiencing cognitive impairment, and living environment and safety. These assessment sections are typical in both private long-term care assessments and Medicaid assessments. Lastly, we will discuss assessment scoring and what a look-back period is. Purpose of the assessment. The purpose of the assessment is to evaluate a person's long-term care needs to determine if they meet eligibility requirements, which is to undergo a functional assessment in order to determine assistance with at least 3 activities of daily living for at least 90 days. An assessment identifies whether there is a functional dependence or if cognitive decline has occurred. The intention of gathering information during an assessment is to fully understand and evaluate a person's functional and cognitive status. Assessments also serve as the primary source of information to develop service suggestions, also known as service plans or care plans. To develop service suggestions, the assessment should include a more detailed health history, such as instrumental activities of daily living, mood and behavior, and living environment and safety. Service suggestions are particularly important because many of us don't know where to start with long-term care. And with WAC Cares, there are 19 approved services. The WAC Cares assessment can identify a person's care needs, determine functional eligibility, and develop suggested services based on the information gathered at the time of the assessment. Gathering a more detailed health history would help us better understand a beneficiary's long-term care needs and be able to provide service suggestions based on the information gathered during the assessment. Next, we will go over activities of daily living. Activities of daily living, also known as ADLs, are related to personal care, such as bathing or showering, getting in and out of bed or chair, using the toilet, and eating. The 7 ADLs for WAC Cares are mobility, bed mobility, transferring, eating, medication management, toileting, and bathing. I'll provide some short examples of each activity of daily living. An example of assistance with mobility could include assisting someone walk from room to room or assisting them to walk outside, helping someone with the use of assistive equipment, such as if a person uses a walker in their living environment, but they need more help when they're out in the community. A person may become fatigued and short of breath when walking for longer distances out in the community and will require assistance, such as someone walking next to them or even pushing them in a wheelchair. Assistance with bed mobility could be helping someone reposition from lying down or from side to side. Transferring can include assisting someone move from a bed or chair or from a wheelchair to a standing position. Assistance with eating can include sitting next to someone if they're at risk of choking, or physically assisting them with their food and or drink intake, whether that's by mouth or through a feeding tube, like placing food on a fork or spoon, getting the food from the plate to their mouth, or assisting them to open containers or packets. An example of assistance with medication management can include helping someone take their medication, such as placing the medication directly in a person's hand, or prompting them to take their medication, such as reminding them to take their medicated eye drops. Supplements and over-the-counter medicines would also be included. An example of toileting could include assisting someone use the toilet or a bedpan or commode, assisting someone to get on and off the toilet, helping to cleanse or helping to change any pads, or assisting with a catheter or ostomy. It could also include helping someone unzip or unbutton their clothing so they could use the toilet. An example of assistance with bathing could be assisting someone getting in and out of a tub or shower, helping a person wash part of their body or their whole body, reminders to bathe or shower, and putting in a shower chair or bench so that a person can wash their body. And at WA Cares, we also understand that not only functional limitations can affect a person's ADLs, but also cognitive limitations. Cognitive impairment can absolutely affect if and how someone completes their activities of daily living. And eligibility criteria will be developed to ensure cognitive impairment is addressed in the functional eligibility criteria for WA Cares, such as including supervision, cueing, or reminders to complete an activity of daily living due to cognitive impairment. I also want to mention that WA Cares relies on a functional eligibility threshold that is similar to Medicaid's nursing facility level of care standards, also known as NIFLOC. So individuals who typically meet functional eligibility for NIFLOC should also be eligible for WA Cares. This is the standard that is used in residential and home and community-based care. Next, we will discuss mood and behavior. Mood and behavior. The intention of gathering mood and behavior is to understand if any mood or behavior symptoms have caused a person disruption to their daily activities. Many individuals with cognitive impairment often go through the moods and behaviors listed on the screen, such as needing redirection, experiencing hallucinations, aggression, agitation, isolation, wandering, and being withdrawn. If a person is experiencing these moods and behaviors due to cognitive impairment, then it is likely that they also require a level of assistance of supervision to help them complete activities of daily living. Many individuals experiencing cognitive impairment are typically able to physically complete ADLs or part of an ADL, but they require supervision, such as cueing or reminders in order to fully complete ADLs. There are several WA Cares Fund approved services that could help address cognitive impairment needs, such as memory care, adaptive equipment and technology, personal emergency response system, dementia supports, or in-home personal care. I will provide some short examples of the moods and behavior listed on this slide. Needs redirection is a technique that is used to shift a distressed person's attention away from the situation triggering their cognitive impairment symptoms. Hallucinations are false perceptions of objects or events that are caused by changes within the brain that result from cognitive impairment, such as Alzheimer's. Aggression can happen suddenly. It could be physical or verbal, but it's important to note and to understand that a person with cognitive impairment, such as Alzheimer's or dementia, are not acting that way on purpose. Aggression can be caused by environmental factors or in poor communication. Due to a loss of cognitive function, someone may be unable to articulate the cause of their physical discomfort and may express it through aggression. Agitation is also very common. It has been associated as a behavioral symptom in mild cognitive impairment in Alzheimer's dementia. Isolation has also been associated with poor cognition and aging. Studies have shown that poor cognitive performance predicts higher social isolation. And wandering is another common behavior in individuals with cognitive impairment. It can happen at any stage of Alzheimer's or dementia. And once a person starts to show signs of wandering, then they're at a high risk of wandering away and getting lost. And lastly, feeling withdrawn is another common behavior in individuals with cognitive impairment, especially in challenging situations. Challenging situations may cause a person with cognitive impairment some distress. Therefore, they become withdrawn and will socialize less and communicate less. Next, we will discuss instrumental activities of daily living. Instrumental activities of daily living are also known as IADLs. WalkCares is considering 7 IADLs, such as essential shopping, housework, meal preparation, transportation, wood supply, using the phone, and social participation. IADLs are more complex than activities of daily living, ADLs. They require more planning, thinking, and organization. IADLs are more commonly associated with living independently. They involve things done around the house, but also out in the community. Instrumental activities of daily living are different than activities of daily living, regular activities of daily living, because ADLs are very basic activities that allows a person to care for themselves, such as eating and bathing. While IADLs are more complex because they involve problem solving and organizational skills, such as meal preparation and managing transportation. IADLs wouldn't count towards a person's functional eligibility, but they are important to capture for service suggestions. For example, IADLs of essential shopping, housework, meal preparation, and transportation align with a few WalkCares approved services listed in the RCW, such as in-home personal care, home delivered meals, and transportation. I will provide some short examples of the IADLs listed on the screen. Essential shopping is how shopping was done to meet a person's care needs, which would include how shopping with a person or for the person. Housework would include things like doing dishes, dusting, making a bed, cleaning a bathroom, tidying up, and laundry. Meal preparation is how meals were prepared for a person, such as like planning meals out, gathering ingredients together, cooking, setting food out and the utensils, as well as cleaning up. Transportation is how a person traveled from place to place. This would include a person driving themselves or traveling as a passenger in a car or taking a bus, taxi, or rideshare. Wood supply is if wood or pellets is a person's only source for heating or cooking. It's how the wood and pellets were supplied, which would include how wood was split, how it's stacked, and carrying it. Using the phone is how a person used a phone to communicate their care needs. And social participation is how a person is involved in social activities with others or within the community. Next, we will go over living environment and safety. Living environment and safety will not count towards a person's functional eligibility, but I wanted to share this because it is a standard section that is evaluated in long-term care assessments. It's important to identify environmental conditions that are hazardous, which puts a person with limited functional or cognitive capacity at risk. For living environment and safety, WalkCares is considering the condition of a person's living environment, such as adequate temperature, scatter or throw rugs, and cluttered pathways. WalkCares is also considering accessibility, such as stairways or steps to enter and exit the living environment, and stairways or steps to access a sleeping area or bathroom. This information can help identify potential environmental modifications that may make a person's living environment more accessible, or adaptive equipment that could help maximize a person's independence. A majority of people want to age in place, meaning they want to grow old in their own home. It's critical to make your living environment safe and accessible if you want to age in place. And there are WalkCare's approved services to help Washingtonians age in place, such as adaptive equipment and technology, environmental modifications, and home safety evaluation. Those are just a few approved services. There are several of the WalkCare's approved services that can help Washingtonians age in place. Before we move on to the next slide, I want to reiterate why living environment, behaviors, and IADLs were discussed. These are standard long-term care assessment sections or standard components of long-term care assessments, and assessments serve as the primary source of information to develop service suggestions. And in order to develop service suggestions, then a more detailed history is needed, such as including IADLs, living environment, and behavior. Lastly, we will discuss assessment scoring. Assessment scoring includes what a person actually did with each activity of daily living, how much assistance they received with each activity, if they received any, and over a certain period of time, such as 7 days. This period of time, the period of time, is also known as a look-back period. A look-back period is a certain time period over which a person's status is captured during an assessment, and the assessment date is the end date of a look-back period. A 7-day look-back period is a standard that is used across the long-term care industry, both in private and public. WalkCares is also considering a 7-day look-back period to align with industry standards. The performance of ADLs will need to be documented for eligibility purposes. Documenting what a person was actually able to do with each ADL may help communicate their needs with providers and better understand how services could meet their needs. Now I will pass it back over to Ariel for our next section. Thank you.
Thank you so much, Maria, for walking us through the details of an assessment and the different components that we are looking at when it comes to the WalkCares assessment. We are now at the point of the presentation where we're moving into the discussion part. I'm going to be opening up the chat feature. So if you are able to, or you want to engage via chat, you are welcome to do that. In addition, if you would like to come off mute, you can raise your hand and I will come in and work my magic and allow you to unmute yourself. I do ask that folks who are coming off mute be mindful of time so we are not eating up too much time on specific topics. But you know, try and keep it around 2 minutes, and know we can always circle back or follow up outside of this presentation. So with that, I'm going to transition us to our first discussion point here. And really, you know, the format of this is we have the questions up on the screen, but we're looking for input from you all. And I imagine each of you are coming into these discussions with different backgrounds, different parts of the industry. Maybe you are someone who is going to be a beneficiary in the future, or you're going to be representing beneficiaries, or you're a provider, recognizing you may want to know information about beneficiaries in the future. Like, there's all different ways we may be engaging with this program. And it's really important for us to hear from you on these prompts. It's really coming to, you know, the information we learn in these spaces is really going directly into supporting our drafting of rules. So our first question is up on the screen, and it's really 2 questions that we're going to tackle simultaneously. The first one is, what do you think is important to keep in mind when drafting rules on beneficiary eligibility determinations, which are also assessments? And on top of that, what accessibility and equity considerations come to mind regarding rules for beneficiary eligibility determinations, also known as assessments? And I see a question coming or a comment coming in the chat, saying I would recommend adding a genuine CI trigger in the next legislative session. And Stephen, I'm hoping you can clarify what CI is here. Make sure we're all interpreting that the same way. By using this novel interpretation of the ADL trigger, WellCares is ensuring supplemental long-term care insurance products cannot wrap around it. This has the counterintuitive effect of making the program less helpful to most residents, and cognitive impairment is what CI represents. All right, well, and that's interesting to hear, Stephen. I appreciate you putting that in the chat. Part of our scoring criteria, again, is looking at that supervision level or reminders or cueing, really to try and get to that cognitive impairment support. So curious to hear more, though, if there's a different way of approaching that would be really helpful to hear. So I'll pause here, and again, looking for answers to the questions up here on the screen. Again, know they're very important to us and very curious to hear your thoughts. And for those of you who may just be joining us, there's two ways to interact here. You can interact in the chat. You can also raise your hand and I will work on unmuting you. So there are two different ways to participate, and the questions we have here are on the screen, starting with, what do you think is important to keep in mind when drafting rules on beneficiary eligibility determinations, also known as assessments? And what accessibility and equity considerations come to mind regarding rules for beneficiary eligibility determinations? All right, I'm not getting any responses on this one, which is interesting. So I'm going to move on, but if you're typing something, please continue to type it. And I see a comment just coming in here, which is great. I see it might be helpful to consider if there are hospital stays within the last 90 days, or an emergency room visit, or 911 calls in the last 90 days. Yeah, thanks for putting that in. That's helpful for us to consider. And certainly, I think, an important point. So thank you for bringing that up, Carrie. What else? I want to see also if they live alone. All right. Well, continue to think about this question because I will collect answers at any point in time, but I will put the next prompt up on the screen so we can think about some other thoughts as well. Our next question is regarding the assessment sections we discussed today. What do you think is important for WellCares to consider? And the sections we covered today are activities of daily living, instrumental activities of daily living, mood and behavior, living environment, and safety. Right, and I see a question coming in regarding whether or not DSHS or HCA has multiple layers of claim review, such as if the first person denies the claim, does it get escalated to a superior for review and then to a team? I'm gonna have to look into that. I don't know that one off the top of my head, but that's a great question, and thanks for bringing that up. All right, I'm not seeing anything again. This is a quiet group today. And again, please know that what you share today really helps us make sure that we are being as thoughtful as possible about an initial draft of a brand new chapter of administrative code. It's pretty rare we have brand new chapters built, and it's a good opportunity for us to really, um, pull together and come up with some ideas here on how to make that um, a successful chapter for the program. So I see Carrie has put in the chat, I'd consider if they are on another state program. And Carrie, could you tell me a little bit about like what kind of other programs you're thinking of when you say state program? I'm curious what comes to mind. And then Beth says, will the mood and behavior be reviewed after the initial assessment? Individuals with cognitive impairment tend to experience changes in these areas. And that's a good question, Beth. I'm curious if you could tell me more about that, because I'm not sure if we've gotten to details about that and whether or not, are you thinking like a new assessment being done to update the information, or are you thinking about like a review after that first assessment interview where it's reviewed, kind of like a secondary review? I'm curious what you're thinking when you say be reviewed, so I can capture that in more detail. And Carrie's put in the chat here some clarity around the different programs. So another program that is already supplying a benefit of in-home care, such as the CFC COPES, MACT, SOA, or Family Caregiver Support, or DDA programs. Okay, thank you. Thanks for putting that in and clarifying. I think that's really helpful to think about. And I do know, we're working hard on trying to identify, as clear a pathway as possible for folks who may be already on other programs and interacting with WA Cares. How can we make that as smooth as possible for a beneficiary interacting with multiple programs? I see a question coming in. Will you be considering the different situations for people living alone compared with people who have help from family members? For example, in the MTP program, it is more difficult for individuals to meet the NIFLOC, unlike the care recipients receiving help from friends or family. And that's a great point, Lindsay. I am curious if you have some ideas on how to address that, because I know that is, as you've brought up, an area that comes up in other programs. And it sounds like you may have some familiarity with that. So if you have some ideas on how to consider that within an assessment, that would be really helpful for us to think about and kind of get that perspective that you have there. So very curious if you could share any recommendations on how to consider the different living situations folks have. I see a recommendation, always a good idea to prepare family for the assessment, such as who would be present during the assessment or not present, who's allowed, what forms may be necessary in advance. Yeah, that is a great point. And I think that's going to be a really important piece to make sure those assessments are effective and getting the right information, in that assessment period, assessment visit. It's a great point. Thank you. And Beth, I see a comment you've entered here, a review after the first assessment. So this is clarifying a comment from earlier. Having firsthand of being a caregiver, this was not reviewed after the initial assessment, and we saw radical changes in mood and behavior that was not addressed in our care facility. Okay, that's good to know. That having a review of that mood and behavior section may be helpful. especially knowing people can be changing, day by day, month by month. Really being able to capture that. So thank you. What else? What else is important for us to consider? I think we've been coming up with some really fantastic ideas here. And I think this will really help our discussions when it comes to drafting rules for the assessment. And again, just to review the sections we've talked about today, we have activities of daily living, we have instrumental activities of daily living, mood and behavior, and living environment and safety. And I see Carrie has entered a comment. I think this is a follow-up from another comment. For MTP programs, we do the NIFLOC, which is nursing facility level of care for those who are not familiar with that. When they are at home. So meeting NIFLOC isn't too tough if they have just come out of the hospital where they likely received assistance with all ADLs and medications. Okay. What about if they haven't just come from a hospital? And, I often think that like a, significant change in need probably has some sort of hospital or doctor stuff in doctor involvement, but sometimes it doesn't. And sometimes people are trying to make it work at home. So any ideas, Carrie or others, regarding how to represent that when folks are not already receiving support in the home? So let's say they're living alone, they've had a care need change, but maybe haven't had that hospital stay. Any thoughts on that? All right, I see, Carrie. It could be a train wreck when at home and not had a hospital stay. Yeah, I know. I can think of some scenarios, that I've seen along the way where things can kind of get a little bit rough at home when there hasn't been a hospital stay, but there also isn't any support coming in yet. But it's good to kind of picture those situations and go, how do we be inclusive of all the different ways people could be showing a need for care that isn't necessarily that they've received that care. And of course, that's the gray area we need to define further. But yeah, I think it's a good thought to bring up. How do we manage that? All right, and Joan has put in the chat, just thinking about issues about pets and pet care, especially as in some cases the beneficiary or client has a great attachment to their pet. The pet may also be instrumental to their well-being. Is sometimes an issue when having in-home personal care where caregivers are not supposed to take care of pets, but the client may need them to undertake some pet care. Yeah, that's a great point. I think pets for a lot of folks, especially those who may be living alone or feeling more isolated, pets can be a major lifeline, but also a lot of work to maintain their environment and make sure that their needs are met as pets, while also at times maybe not being able to take care of a person's own needs. That's a good point, and certainly a good thing to think about when it comes to capturing that living environment and safety. I'm thinking that may fall into that category. All right, well, I'm going to move on to the next prompt just so you can see it up on the screen. But if you're typing, please keep typing. Again, you're welcome to raise your hand and come off mute if that feels more accessible to you, or you're inspired to speak, feel free to. But I will move on to our next prompt. So it starts off by saying, regarding assessment scoring, what do you think is important for walkers to consider? So regarding assessment scoring, what do you think is important for walkers to consider? All right. And I also see a comment, some people may need assistance past the benefit that WellCares provides, so transition from program to program would have to be worked out. Yeah, and that's a great point, and certainly something we are really considering closely around how do we make sure transition from WellCares to other supports are as seamless as possible, moving to other programs. Here, there's also a lot of scoring for other programs. So it seems like you could adopt from another program. That's a great point, Carrie. And I'm thinking about the programs I think that you put in the chat earlier regarding CFC, COPES, MAC, TSOA. And I apologize for folks with all the acronyms. Some of these I know, some of them I don't. So I'm keeping it simple. But are there any other programs that you think would be helpful, or a specific program that you're thinking of when it comes to pulling that scoring from? And I think it's pretty similar in care, but I'm not sure about the MAC and TSOA programs and maybe family caregiver support program. I'm not sure what that looks like either. And thank you so much for putting that in the chat. That's super helpful. All right, and I see a comment here to clarify: when a beneficiary transitions off of WellCares, do they need a new assessment for the next Washington program they apply for? And that's a great question, and still to be determined. We're still working on that, but I am curious what your thoughts are. If that's something, if you have ideas or solutions there, I think that would be helpful to hear. But again, we are still very much working through how this works from program to program. We're in the very early stages of that. But certainly, again, the goal here is very much to make that as smooth as possible. Right, MAC and TSOA scoring is the same on the assessments. Family Caregiver Support Program is based on the TCARE algorithm. Good to know. And is MAC and TSOA the same scoring as like CFC and COPES? Is that the same? I see Lindsay clarifying here there are financial eligibility thresholds for the other programs, and that is true. That is the difference between WellCares and some other Medicaid programs, is that financial element that may make somebody eligible for WellCares, but not necessarily for Medicaid. So that is certainly something we're working through as far as when we think of that transition to different programs. Okay, and Carrie clarified, I don't believe the scoring is the same because the assessments are so different. It's close for the NIFLOC. Okay. And out of the two, I guess the two categories, let's say they're different, is there one that you would recommend, or one that feels like maybe it more closely aligns with WellCares as a program? I see Lindsay saying recommend the MAC and TSOA scoring. Wonderful, thank you. All right, and I see Crystal jumping in here with an answer for an earlier question. Crystal is part of our WellCares team, working in a different section than policy, but knows so much stuff that I don't know. Crystal said, just trying to help with an answer from earlier, to answer the question earlier about the claim review. The claim will need to be submitted to match the authorization and free of errors to get paid, but the beneficiary would approve all pre-authorizations and BAMs. Thanks for jumping in there, Crystal. And Carrie said probably the MAC TSOA NIFLOC and the screen that tell you what step. Wonderful. All right, so I see two comments regarding MAC TSOA, maybe aligning better with our needs on the WellCare side. That's great feedback to have. And certainly, if others are listening in and familiar with these systems, please jump in. Or if there's some other scoring system that you're familiar with, I think that'll be helpful. And I see a question here. Is a different approach needed for young claimants versus seniors? And that's an interesting question. I will leave that open for folks in the chat, or again, if you want to jump in verbally, you're welcome to raise your hand. That's a great question. I'm going to put our next prompt up on the screen here just to give you some time to think about it. But if you're still typing or you're still thinking about a different question, feel free to put it in the chat. We can kind of jump back and forth. But I just want to give you an opportunity to start thinking about this next one. And the question is, what barriers do you want law cares to be aware of regarding assessments for beneficiaries? Right. Obviously, Carrie has put in the chat. I'm not sure if Carrie, could you clarify what it is when you say that's not going to make sense? What's the that? Just so I can connect that back. But the comment continues from Mac to SOA. If you meet NIFLOC, you are step 1. Benefit is one time, $250. Then we screen for the next step and you score under 9, you're step 2, which is $500 a year benefit. And if you score 9 or better, you're on to step 3, $818 a month. Okay, and Carrie clarified when I spoke about the step levels in MAC to SOA. Okay, thank you. So again, the question we have kind of marinating out there with you all right now is, what barriers do you want law cares to be aware of regarding assessments for beneficiaries? All right, and I see Lindsay saying, as mentioned earlier, the difficulty for individuals to meet NIFLOC. All right. What else? All right, another good question. Do you think there will be adequate assessor capacity? And at this point in time, I think we're feeling pretty good about it. But more to come as we get closer to 2026 and go live, and more projections. But at this point in time, I don't expect that to be a barrier for us. I see educating the public that applications are contingent on the assessment. Okay. All right. Well, again, if you're still typing, please feel free to keep typing. That's okay. I'm not hearing a lot of answers to this one, which is interesting. So I'm going to move on to our next one, let you think about that. But again, you're welcome to keep typing. You're also welcome to raise your hand if you want to come off mute. Our next question is, what do you hope you or others experience when being assessed by a WACARES assessor? All right, and I see one comment regarding our last prompt. Looks like there was a good point, likely easier to meet NIFLOC if it's senior versus a younger person. And Lindsay said in response to the question up here on the screen regarding what do you hope you or others experience when being assessed by WACARES, sympathetic, courteous treatment. I completely agree. Timely. All right. What else? Follow through. What else? What do you hope you or others experience when being assessed by a WACARES assessor? Options. All right. And Carrie, could you tell me more about options? Curious what that is representing, because I think I'm thinking of a few different pathways here. So if you wouldn't mind telling me a little bit more about that. It looks like approved service options. So home delivered meals, transportation, medical equipment. Wonderful. All right, thank you. All right. Well, again, if you're still typing, keep typing, but I'm going to share some resources with you all. I'm going to drop these in the chat. I bring these up each time we do one of these listening sessions because I think it's very important. So in the chat, I just dropped our DSHS WACARES Fund rulemaking website. This is where you're going to be able to sign up for future listening sessions like this one. You'll also be able to find our recordings. So if you've missed a session and you want to, catch up, or one of your peers has missed it and you want them to be part of it, all of our recordings will be available there, as well as our slide decks. We are making those available. And it looks like I accidentally put this in the wrong thing, so let me resend that. I just sent it to panelists. Thanks for catching that for me. All right, let's try again. So we have DSHS website at the beginning, which is specific to the DSHS WACARES Fund rulemaking. And within that, you will find links to Employment Security Department and Healthcare Authority. But on that DSHS WACARES Fund rulemaking site, you'll be able to sign up for future rulemaking listening sessions like we're doing today. You'll be able to see recordings. You'll also be able to see our slide decks. So if you ever miss one, you'll be able to find that information there. Employment Security Department is also doing rulemaking, and I do encourage folks who are interested in the qualified individual or contribution determination side of things to check in with Employment Security Department's website and stay up to date on what they are doing over there. You'll also find Healthcare Authority website. They are not doing rulemaking yet, but they expect to be doing rulemaking in 2025. So follow along with them for any updates that they are going to be doing for WACARES. Again, for program-related questions, you can send that over to wacares@dshs.wa.gov. But if you have questions about the rulemaking process, or you are thinking about the questions we've asked today or in past sessions, please reach out to me. And it's my first name, last name, 2@dshs.wa.gov. I've had a few questions come in from folks who are curious about providing feedback. You take it back to your team, or you process it, or maybe you are a little bit behind in, you're not able to see these sessions live, so you're watching recordings. And please know that I am very open to receiving feedback at any time about any of the prompts about rulemaking for WACARES, like DSHS WACARES rulemaking. You are very welcome to send that over via email to me, and I will be gathering that in the same way I'm gathering the information in these sessions. I do think the sessions are very important because it allows us to have more of a discussion and different points of views are in the room, and I think that's really important. But if for whatever reason you're just not able to share in this space, you are very welcome to send me an email, and I'm happy to receive your input in that way as well. Um, all right, I see one more comment here. Said I would echo the commenter regarding turnaround times. Claims are a time of crisis, and everything is urgent. Yep, I think especially when you are having that care need for the first time, or for the fifth time, it still feels urgent. So thanks for bringing that up. All right, so with that, we've come to the end. As I said, we typically end these about an hour, and we are right on the dot, 3 o'clock. So thank you all for being here with me today. I really appreciate it. Our next session is going to be May 15th at 2 o'clock, and we're going to talk about beneficiary rights and responsibilities. We'll follow a very similar format here. But again, reach out to me with any questions. I always appreciate hearing from you. And I hope you have a good rest of your day. Thanks for being here.